Dr. Bharti, gynecologist and infertility specialist. Today I'm going to talk to you about a very simple but commonly seen OPDs in the gynec, which is called white discharge. So everybody panics about white discharge. Actually, there's nothing to panic about white discharge because white discharge is so common, it is very physiological. So when does white discharge normally physiologically come? Then the answer is it comes few days before your menstruation or few days after your menstruation. And if your cycles are between, like, say 28 to 30 days, it comes in between. That is a mid cycle. That is when the ovulation occurs. Ovulation means the follicle, the eggs grow and then they rupture. That is the time when you will have a mild white discharge. So these are all common things and these are all very physiological things which we need not panic, which we need not go to the doctor or worry about or panic about. So when do you have to really worry about a white discharge, or when do you have to go and attend a doctor? The first and foremost is the white discharge will be foul smelling. That is, it will have a bad odor. Secondly, it will not be white. It will either be green or yellow. The color changes. And third thing, there will be a severe itching. In very rare cases, they also present to us with stomachache, lower abdominal pain with fever. Then it's called a pelvic inflammatory disease. In these conditions, you should definitely go and meet a doctor instead of self-treating you. So why do we get this white discharge? See, the lady's body is made in such a way that the urethra, that is where the urine comes and where the bleeding happens, it is the vagina, and then where we pass the motion, the anus, is all very closely paced. So when there is an infection in either one of these areas, there is a tendency for the infection to spread to the nearby areas. So this white discharge is very common. So what do we have to do to prevent this white discharge? The first and foremost thing is we should drink lots of water. Okay, this water will prevent a lot of infection from happening. We as women go to work, go travel many places, so we are bound to use the common restrooms or the restrooms which in our hospital or the office place or the hostel. So they're not clean. So we should always make sure that we use a tissue paper, clean that area and then pass urine. And then another important thing is immediately clean it. We should not control the bladder. We should allow the bladder, we should let go of the urine, but make sure we clean it. Make sure we see to it that the bathroom is cleaned, and also make sure we clean it with water after we pass the urination. Another important thing is the common thing of infection in that area is that we use razors for shaving. I would never recommend razors or use of any perfumes or anything in that area. The best thing is to just pluck it or just to trim it. That's totally fine. I mean, we change the pads frequently, like say at least 4 to 6 hours a day we change it. And during those menstrual periods, make sure that you keep separate panties instead of using the regular panties. So these are few simple things which we can follow. And thirdly is, like, after a sexual intercourse, you should make sure that you clean that area with just water. You don't even have to use soap, because naturally there is a bacteria which helps to maintain the flora. So when you use soap, that actually affects the bacteria, so the natural immunity is gone. So sometimes we also prescribe these vaginal wash. You don't have to worry whether that will kill the natural bacteria. That doesn't affect the natural bacteria. It is made in such a way. So these kind of vaginal wash also helps us. So white discharge is nothing much to worry. If we just drink lots of water and keep that vaginal area very hygienic, we can easily overcome it. Thank you.